before the break, and I'm pleased to give a chair to Professor Ivanov, who will tell us about the GMDP history, starting from Mечников ideas to nowadays receptor ligand. Thank you.
Thank you very much, dear colleagues, ladies and gentlemen. This is not history, it's rather a story, which I'm going to talk to you about. The beginning of this story dates back to almost exactly 100 years ago, connected to the famous name of Mечникov, a story to which our institute contributed in the middle of its development, and the final accord of which is still quite a long time ahead. It all started when Mечникov, in his one of his famous books, Essays of Optimism, or Optimistic Essays, or whatever you prefer, tried to analyze the origin, the reason of longevity of people, of good health of several nations. He noticed that Bulgarian nation has unusual number of centenaries, and he tried to explain this fact that Bulgarian people use fermented milk products as sometimes the main component of their diet. Anyway, they consume a large amount of fermented milk products, and he believed that there is something very good to human health in those products. He even made a tablet, a pill with live lactobacilli, but this initiative didn't last long. It was forgotten until in the 50s, Bulgarian doctor Ivanov decided to look deeper into the matter. They produced in fermenters biomass of Lactobacillus bulgaricus and tried to look in detail at the biological properties of this bacterial mass, and they even developed some anti-tumor preparations. Still, it seems on the market under the name of Diodan. This is an oral preparation, and this is today's state of affairs. However, much earlier, in the 70s, in the beginning of 70s, Bogdanov came to our institute saying that, look, we have an interesting medicinal preparation which is used in practice, in oncology practice. Why not to have a look at the active principle of this preparation that we use? And people in our institute did some work, and they came with a proposal that the active principle of this Lactobacillus bulgaricus preparation is this glycopeptide, which resembles to some extent the bacterial cell wall, having typical amino acids that participate in the construction of bacterial cell wall, unusual cyclic moiety, and standard disaccharide N-acetylglucosamine, N-acetylmuramyl disaccharide unit. We were in a peptide chemistry laboratory, decided that if such product has interesting biological properties, why not to synthesize? We entered to the synthesis, made the total synthesis of this molecule. It was not quite trivial, but still it was quite straightforward, ending up with this product, which turned out to be completely inactive and having nothing in common as far as physical properties are concerned with the anti-tumor preparation of Ivan Bogdanov. So this formula was apparently not right. It could be a deadlock of this work, if not the developed method of synthesis of this cyclic peptide. In course of developing the method, we synthesized a number of model molecules without the cyclic moiety, simple glycopeptides containing di-tri-tetrapeptide moieties attached to the disaccharide, either the monomeric disaccharide or the dimeric disaccharide. So it's either disaccharide or tetrasaccharide. And we'll also look at the biological properties of those model compounds. And in this case, several of them were quite active in model transplanted tumors. And that was quite promising, quite interesting. We patented both the method of synthesis and the molecules in '77. Took it to national patent. Until this stage, Yuri Ovchinnikov was a participant of this work, and then he let us put the chemist to carry on our cells without his supervision. Here is the simplest molecule that showed the full activity of the Lactobacillus bulgaricus preparation, and it immediately struck us that this molecule is very similar to a so-called muramyl dipeptide, which was known as the substitute for mycobacterial component in the complete fluid adjuvant. As you know, complete fluid adjuvant is the most powerful immunostimulant of for the induction of immune response to various antigens. It looks like we have a similar family of molecules, and the difference between the well-known muramyl peptide and our as you realize is called GMDP molecule is very small, and this might be they might have several common properties. And indeed, when we looked at the immunostimulatory properties of GMDP, it showed a large spectrum, a wide spectrum of in vitro and in vivo systems. It became quite clear that we have one family of immunomodulators with anti-tumor properties, and we also showed anti-tumor properties in our test systems. With one difference, well, not one, several differences. Generally, the disaccharide containing glycopeptides, including GMDP, were more active in all systems, in all immunostimulatory test systems, anti-tumor activity, and it showed less pyrogenicity. Not so strong inflammatory action. MDP cannot be used systemically by injection because it causes very strong toxic effects. With GMDP things were better. They even could be used orally. Generally it was more active in most of the test systems, and therefore we continued working in this area, as a result, the GMDP became a registered pharmaceutical in '95 under the name of Licopid, and all the appropriate clinical trials according to GMP standards were carried out, and this work even was awarded the governmental prize in '97 for development of this new pharmacological product and introducing it to the market. All that is fine, but scientifically the situation remained rather unsatisfactory because the mechanism of immunological action of this pharmaceutical and of the whole family remained not clear, and the work continued in our institute. And Volodya Ivanov, who is unfortunately no longer with us, was a key person in that continuation, and he was the first to state that muramyl binding peptide sites responsible for immunomodulatory activity of this molecule are located inside the target cells, mostly macrophages. This work was continued without final result, without final conclusion of what is the molecular target of this group of molecules. The crucial work in that area was done by two groups, the American one and the French one. In 2003, apparently under the condition of strong competition, they simultaneously published the two papers in JBC with the same conclusion. The host recognition of bacterial mineral dipeptide molecule receptor is so-called NOD2 receptor. It's nucleotide oligomerization domain type 2 receptors. So it's one of the receptors of the innate immunity. There are two main types of innate immunity receptors, and Professor Neraspasov spoke about that aspect in his talk day before yesterday, we extended this work in a joint in a collaborative effort with the same French group with the same conclusion that disaccharide containing glycopeptides also belong to NOD2 ligands. And this is the first step of the molecular action of this group of molecules. In a simplified way, the mechanism looks today as following. The NOD2 receptor, here we see several domains of this receptor, interacts with the glycopeptide, which comes either artificially as a drug or as a part of the degraded inside the organism, inside the host cell wall. This interaction of GMDP or miromill peptide with the receptor leads to dissociation of the kinase, which becomes activated and which phosphorylates the inhibitor of NFKB transcription factor. After that, the inhibitor releases the factor, and the factor does its job entering the nuclei and inducing various synthesis of various molecules. Here we see the induction of interleukin-1 synthesis, but there are many other cytokines also induced by this process. This is a very simplified way of presenting the mechanism. There are several alternative ways, but this still is supposed to be the main path which is followed by the host cell under the action of that family of glycopeptides. When that became clear, we received all the reason to put this group of pharmaceuticals as a well-deserved member of the family of pharmaceuticals, each acting on a particular type of receptors of the innate immune system. After that, it seems that in the hands of pharmaceutical community, there are tools to manipulate with each type of the receptor, and we contributed to one of these type of interactions. So now things became more satisfactory from the scientific view. What could be the consequences of that? Of course, we understand better the in vivo interactions that are induced by the application of this GMDP immunomodulator. For example, here is one of the examples. Today's concept about the action of the immune system, today's understanding is that the overall work of the system is regulated by two types of the immune cells, so-called T helper 1 and T helper 2. The first T helper 1 are responsible for regulation of the innate immunity or the cellular arm of the immunity, and the T helper second type are responsible for the production of antibodies by B lymphocytes. Both types of T helpers are regulated by quite a variety of regulatory molecules called cytokines, and some of these cytokines stimulate proliferation, differentiation of the Th1 cells, and some are responsible for regulatory, for proliferation and differentiation of Th2 cells. It was noticed that cytokines induced by GMDP correspond to cytokines that stimulate the activity of Th1 cells. So it would be logical to assume that the effects of GMDP and related products are related to stimulation of the Th1 cell at the expense of Th2 cells. And this could explain the beneficial action of these molecules in various patients, asthmatic patients, patients with allergies, where Th2 cells are responsible for that pathological state. We looked at the action of two key cytokines, interferon gamma, which is stimulator of Th1 cells, and interleukin-4, which is stimulator, inductor of Th2 cells. And we found that under the action of GMDP, under certain conditions, when you have induction of proliferation, intact cells, both in healthy donors and in the patients with asthma, practically don't react to GMDP action. While if you have specially treated cells, you see apparent increase in the activity of these cells induced by interferon gamma. And with interleukin-4, it's the opposite effect. We see inhibition of interleukin-4 production by these molecules. So we confirm the hypothesis that the beneficiary activity of the drug of GMDP is due to the shift Th1 to Th2 in the T helper balance. Therefore, all the results of the clinical trials could be reconsidered after this result. And in addition to the previously reached conclusions about the action of GMDP, we can add one more. GMDP exerts pathogenetic action. It not only treats the consequences of allergy and asthma, it's active in the basic state, at the pathogenesis of the disease. It shifts the T helper equilibrium. This could be the end of this talk, but you have all the right to ask me the question, what about the anti-tumor activity? It all started as anti-tumor product. What is the state of affairs now? It is quite well justified question. There is anti-tumor activity, and the work goes on in clinic. The work organized by the company Peptech, affiliated with the Institute, at several clinics in Moscow, in Tyumen, and Tver, and other clinics not shown here. There are various indications where this product seems to be beneficial in treating the tumor patients, but of course it takes a long time. If you notice, the GMDP was registered in '95 and patented in '77, so 18 years it took to reach it as immunomodulator. Of course, it's not an easy thing to reach the final step of development of a product. Let us hope that the indications for using this interesting group of pharmaceuticals will be extended in near future in the tumor patients. This is about all that I was going to talk to you. My last statement is based on these conclusions. There is activation of anti-tumor activity combined with the correction of chemotherapy-induced neutropenia and immunodeficiency. The last slide, I am obliged to mention the medical doctors, the clinicians who are at present working and who contributed to the final part of my presentation. Thank you for your attention.
Thank you very much. Questions are welcome.
Very interesting, David. The elderly people have a diminished immune response. Is there any way that with this immunomodulation you can restore a juvenile response?
Well, it's a dream, of course. No clinical data which will give positive answer to you to your question. But I think I know that many people just are taking this ligapid for that purpose. They didn't complain. No side effects are observed.
No. Sorry, you say no clinical data. It was tried with negative effect or no data?
Well, nobody has said such a trial yet.
No, nothing was done.
No, nothing was done with this particular molecule, but to my knowledge, I think in the United States there appeared a nutritive, I mean not a pharmaceutical product, but additive, which they claim contains GMDP, and the purpose of that additive is to keep you young. Yes. Who knows how correct is that statement?
Time for a couple short questions.
Yes, I noticed in your slide on the tumour activity that still there, most of the effects were on prevention of infectious disease. Could you summarise the activity of this compound directly on tumour cell proliferation, the primary or metastatic tumours?
All the data on the primary tumour are dating back to Ivanov. He did a good deal of work on his preparations, and they work both on primary tumors and in vivo on animals and transplanted tumors. They claim they have several cases of curing uncurable by other means tumors. We didn't do, we have no such information from our clinical people. They are working more cautiously, you know. They use the product for indications that are already proven. So correcting the immunodeficiency caused by tumor prevention. But certainly there are many indications that are direct anti-tumor activity, induction of T killer cells and so forth. But this has to be better documented.
May I ask you a question? There are some differences in actions between MDP and your GMDP. Could they be followed and some parallels in their different affinity, probably in interaction with the receptor?
I didn't see figures about the affinity of GMDP and MDP. What we did in our work together with French collaborators, there was a good correlation between the adjuvant activity and the binding activity. I believe there must be a correlation between these two things, but still these are very closely relatives, these two molecules. So all the quantity differences might not be very principled.
Thank you very much. We should also from the same institute.